Good afternoon, everyone, and thanks for being back. This place seems kind of quiet after last week in here, but good to see everybody back. I hope everyone enjoyed the weekend and was able to get outside a little bit this weekend. On Friday, we traveled to Kansas City area to visit the Ford assembly plant in Claycomo, and it was impressive to see what Ford has been doing, and Ford Motor Company issued a return-to-work manufacturing playbook for the reopening of its manufacturing plants and other facilities that we had the chance to see these new policies in action. I just want to go over some of the new procedures they had. It was kind of interesting, but the daily COVID-19 survey and non-contact temperature scanning prior to entering the facilities is something all their employees have to go through. Daily cleaning and disinfection of the workstations and common areas. They had guidelines and recommendations for social distancing inside and outside the workstations. And then the appropriate use and application of PPE were required. Ford also has designed measures to control the flow of people entering and exiting the facility. Over 7,000 employees work at Ford's Kansas City assembly plant, and it was impressive and encouraging to see the steps Ford has taken to hold themselves accountable and to ensure its workers and customers are healthy, safe, and protected. Many other companies and small businesses across the state have also stepped up to assist and implement new health and safety measures. And I'm so proud of Missouri and the people of this state for what they are doing. And I want to thank them for their efforts, and that is the reason we are recovering here in the state of Missouri. The economy is reopening. Our unemployment claims have declined as Missourians return to work. I'd like to share another positive story with you today about a COVID-19 patient in Missouri. A young, otherwise healthy, pregnant woman had been hospitalized for COVID-19. Last week, she was beginning to take a turn for the worst. The next day, the doctors began the treatment of remdesivir, a drug that in its early stage of being used to treat COVID-19 patients. After receiving the drug, the young woman began to show very quick signs of improvement. In addition to those 400 vials of remdesivir that we actually delivered, Dr. Randalls and his team did, and the Highway Patrol did it, I think, 2 or 3 o'clock in the morning last week all over the state of Missouri, and we received the positive results. As we received earlier last week, we received over 1,200 new vials on Friday to distribute. These were immediately shipped out to 33 hospitals to treat 115 patients in intensive care units throughout Missouri. And again, this is all very positive news, and we continue to be hopeful for the future. As you know, testing is one of the 4 pillars of our Show Me Strong recovery plan, and this will continue to be a priority moving forward. We have significantly increased our testing capacity, and now we must be thinking of ways to increase the number of tests being done. As we do this, it is important to remember that the more tests we do, the more positive cases there will be. But again, I want to emphasize that not all of these positive cases are hospitalized. The vast majority of people have already recovered or are currently recovering at home. Some people with the virus do not show symptoms at all, which is why we are working to identify these individuals and isolate them as quickly as possible. We are especially working to increase testing in high-risk settings, such as long-term care facilities. The long-term communities, including residential care, assisted living, immediate care, and skilled nursing. We have a total of 163 homes that have had a positive case, either a resident or staff or both. Of the 163 cases, 72 have not had an active case diagnosed in the past 15 days. Of the 91 homes that have been an active case diagnosed in the past 14 days, 41 have had faculty-wide testing completed, which we were able to move in quickly and be able to test everyone in those facilities. We will be working with the 50 homes that have not completed faculty-wide testing this week. We are working on a prioritization of these homes to ensure that the facilities most in need can complete facility-wide testing. Dr. Williams is here today, and he's going to be able to answer a few things. He's going to give you a little update when I finish up here about some testing they did in St. Louis. Again, I just want to say this and kind of wrapping up. The one thing that we are going to continue to do, and I am going to push my directors, everybody in the state of Missouri, as much as I can. We're going to have to get better every day at testing, and we're going to have to do more and more testing. That is crucial for the time as we speak today, as it is 3 and 4 months down the road to be able to face that. It is going to be a priority of this administration, and we are going to continue to push those numbers up daily. As we get closer to the end of May, we are still optimistic about the days and weeks ahead. However, I want to remind everyone that we must still be very cautious and proactive. Much of Missouri has reopened, and even some of our urban areas, such as St. Louis and Kansas City, are beginning to lift restrictions. This is a good thing. We cannot let our guard down, and we still must understand to open up the economy and fight the virus. And we have to remember that this virus is still out there, and we must continue to protect ourselves and others. Continue to social distance. Continue to use common sense and make safe and smart decisions. And as long as we will continue to do this, Missouri will continue to improve. I will say again, and I've said many times before, to fight this virus, it's going to take everyone in the state to do their part, which means it goes back to your responsibility as individuals. A government, again, will only do so much, but at the end of the day, it's up to all of us to do a better job at social distancing and keep in mind the virus is out there, and to keep in mind that the economy has to go. We have to get people back to work, whatever it takes, and that's what we're going to do in this state. So, again, thanks everybody for being here today, and God bless. So, Kelly, let me Dr. Williams come up. He wants to give you a little update, and while he's up here, if you want to go ahead and ask questions when he finishes up, ask questions to him, and then I'll be back to answer questions. Dr. Williams.
Thank you, Governor. And just to those physicians who called me, thanking me for the remdesivir, I just got one 5 minutes ago before I walked in here. You're welcome. I know how that felt to be able to give that drug as an obstetrician to that person and see her turn around in 24 to 48 hours, and her baby's doing well as well, and so we're incredibly thankful for that. But when you thank me, you're really thanking the governor and his team for working with our federal authorities, Jim Remillard, Sandy Karsten, Bill Whitmore at the lab, the National Guard, the people who flew it, the people who got it there quickly. So I will certainly convey their appreciation to them. As the governor said, one of our pillars that has served us so well is testing. We've been very strategic about that. It helped us in the height of the infectious epidemic here, and it is so much a pillar going forward, foundationally to us, to make sure that things are continuing to go well. It is an early warning sign. So we've been so appreciative to Missourians who've followed social distance, who've gotten the 150,000 tests we've done. But we have another plea for you. We really want to encourage Missourians as we move into this, that if you have any symptoms, muscle aches, fever, cough, anything, we want you to get tested. We want to see exactly how we're doing as things change. So to those clinicians, to those patients, to those people, like when I was in Aphinia last week, who said, well, I'm just getting tested because I take care of somebody who might have had it, or I work in a healthcare facility, we want to encourage all those people to get tested. I was in Aphinia, I told you about that last week, where I think we were in 6 mobile testing sites. So far, the early results, as the governor said, we did 288 tests, 14 were positive, 97 are pending. And that information is incredibly helpful to us as we look, as we change things. That's what we've always used the testing for, not only to help individuals, but to help guide the advice we give the governor. So I'm going to make a plea today that if you're a clinician and a patient wants to be tested, please test them. That's very helpful to us to do that. The other thing the governor mentioned about, I told you we were going to do this, and I hoped it was going to be today, and it is going to be today. We are issuing an order today that in any long-term care facility that has one patient who's positive or one staff member who's positive, that we are recommending comprehensive testing, that you go in and check everybody, a capability we didn't have a month ago. But as the governor said, there are 50 facilities right now that meet that definition as of today. So we worked all weekend, we're working today to go in and test everybody. And so that's our boxed-in strategy, which we think will serve us well. But we're kicking our testing into another gear, and that's around what we call prevalence testing. And we did a small group of that about 2 weeks ago where we checked 3,000 people. But these, again, are where we're kind of putting out, for lack of a better term, kind of triggers or alarms to see what's going on. So to all those people who agree to do that, we thank you. And then the third one is Sentinel testing, and that's the most important. We've learned from this, as I've told you before, certain groups are at high risk, and one of those are clearly our long-term care facilities, our jails, our prisons, our meatpacking plants. So going forward, we're going to ask many Missourians to agree to be tested as Sentinel testing, and we're going to do a lot of that because we want to see if anything's brewing, if anything's trying to kind of kick up. So that starts today. We will be doing that in a very large way. The governor and I were just talking. It was his idea, but I told him I was going to take it. It's also kind of like building a muscle. As we do this testing and we get out there, that may serve us well going forward in the fall and the winter. So it was actually the governor's analogy, but I told him I was going to take it. And I think it's a great one, is that it enables us to get into that habit of testing and using that. Kelly, I'm happy to answer any questions.
Any questions for Dr. Williams?
Hi, Dr. Williams.
Hey, Philip.
I'm over here.
Oh, Philip. Hey, y'all. That's pretty good.
Are we still at a capacity of 8,800 tests a day, or has that increased anymore?
I looked at it. We are getting close to about 8,000 to 9,000 a day. One thing that's been added is as many of the hospitals are using their own Cepheiad and other machines to do pre-op testing. And so I saw the latest projection would be about 10,000 tests a day, I think, in another week or so. But right now we're hovering right around 8,000, heading toward 9,000.
And when you say you'd like to expand Sentinel testing quite a bit, does that mean every such facility, like every long-term care facility, every meatpacking plant?
Yeah, we're looking at that. I mean, we're in conversations with them. We have 162 long-term care facilities and about 12 to 13 meatpacking plants, and we're very much in conversations with them what periodic surveillance would look like through the summer. Yes.
And so those are all such facilities, not just the ones that have cases?
Yes, going forward, that would be all such facilities, absolutely. That one, and then I just got a call from Kansas City. But to your point, we will gather that data. We'll look at that, and we have another call this Saturday, so we'll be getting follow-up on that as well.
Hi, Dr. Williams.
Yes.
So Boone County had, on Sunday, had a large jump just in relative to what we've seen in the past month for cases. Is that number concerning at all, or what number should we start being concerned if we see a large spike in a certain county?
Well, the first thing we always do is we immediately drill down on what explains that number. And when you have an increase like that, the first thing you think of is a congregated facility, whether it be a jail or long-term care facility or whatever. I'm not familiar yet, and I will this afternoon, what happened in Boone County. But that's the first thing we look at. And to your point, that's the kind of thing that we want to stay vigilant about. Is there's a difference to us between 4 patients who didn't know each other who got positive versus 4 patients in one facility. We interpret those differently. So, but to your point, we're watching those very carefully.
Okay, and then so obviously once we start increasing testing, there could be another spike in cases. We'll start seeing some more. Is there like a certain point where like that's too many? Like what's kind of that look like?
Yeah, the number in the literature is 10%. we would like to see a positivity rate less than 10% with our testing, and that's a federal kind of guideline as well. We're there in Missouri. We're less, as a matter of fact, if you look at our most recent testing, I've seen numbers on days of like 4%, 5%. Our state lab will always be a little bit higher because it's a kind of a selected population. But 10% is the number we kind of keep a close eye on, both regionally and statewide.
Hi, I have a couple questions about antibody testing.
Yeah.
So what does the future of antibody testing look like in Missouri? Is it going to be the boxed-in strategy where you test everyone in a meat packaging plant, or can anyone get an antibody test?
Yeah, so I looked at those numbers this morning. To date in Missouri, not through the state health lab because we're not up and running yet, there have been about 12,000 antibody tests, of which 296, I think, have been positive. Check with Lisa on that number. I may not have that exactly right. But it's that it was 200-something out of 12,000. So we know that going forward. Those are presumptively positive. We don't count them in our data that you hear on our website. We treat them differently. And so that kind of gives us an idea about that, realizing we check those 3 weeks after you've been tested positive with the PCR test. So to your question, how will we use that antibody testing going forward? And I think what I think is going to happen, and we talk with a lot of county commissioners who are interested in this, I think its first utilization is going to be really around healthcare workers and first responders who've been through this spring and are curious whether or not they were asymptomatic or what they had was. So I think that'll be the first utilization of it. Then I think the second utilization of it later in the summer will be prevalence studies. We will go in and instead of doing the PCR test to see if you're actively infected, we're going to go in and kind of get an idea going into the fall how many people, I think people have asked me, how many people do you think in Missouri would test positive? And we want to find that out. So that'll be a large-scale antibody testing that we'll do there. And then at some point, we think it probably also has some utility for our congregated facilities like prisons and meatpacking plants and others. And I've been in conversations with those people. We think it's a little early for that now, but I think around July or August we will start that process of doing antibody testing as well as sentinel testing and prevalence studies.
And then how many people in Missouri that have COVID-19 have been treated with COVID-19 antibodies?
Yeah, I don't know that number. Anecdotally, we talked to Governor. I was on a phone call with Springfield Saturday morning, and they had treated several patients, but I don't have that cumulative number. My sense is from talking to people, they think it's helpful.
I will take one more, Philip.
So if you add together the number of people who've tested positive and the number of people who have positive antibodies, in time, could that be used to determine who gets a vaccine and when? If someone has already had it, then they don't need it?
Yeah, certainly with the antibody test. But you bring up a point, which is when we talk about antibodies, because this is a novel emerging virus, that doesn't guarantee immunity. We just don't know that yet because it's new. Now, people will say, well, Dr. Williams, for other diseases, if you have antibodies, doesn't that usually speak to immunity? And it does. But we don't have enough scientific knowledge yet to equate antibodies with immunity. In other words, as a clinician, I couldn't say, oh, you've got antibodies, you're good, don't worry, you don't need a vaccine. We're not there yet. Well, that will remain to be determined. But I do think having antibodies would be useful to know if you're in healthcare or you're with Sandy Carson in public safety and that kind of thing. I think it would be helpful. Again, thank you all so much, and I'll just end as I started. We really would encourage all clinicians, all Missourians, if you want to be tested, if you have been around somebody or you take care of people or whatever, if you're just concerned, we hope your clinicians will test you. We encourage that. We thank you for doing that, and it's very helpful to us, so thank you.
Governor Parson?
Good afternoon, Governor. Two questions for you. One, looking back at Friday with what was passed through the legislature, are there any bills that you know for sure that you will sign?
Well, I think there's some in there. We're still going through the process of evaluating all them. I think I think my staff told me earlier today when we got briefed on that there was like 27 bills I think made it across the finish line, which was good news. There wasn't hundreds of them. although I do think there was a lot of changes in just those 27 bills. I think things, one that I hope comes through that's clean, is good, like full reciprocity. I think that getting that done and the military reciprocity we got done this year were two big, those are just huge lifts right there to get them done. Actually, that last one that the legislators did probably is a leader in the nation when it comes to full reciprocity, and if there's ever time to pass it, it is a good time doing it there. I'm trying to think of some of the others in there, but again, we need general counsel to go through it and just make sure everything's all right, that we can get it out and sign it. We feel like it's constitutional.
And a second question, Governor, the scheduled execution of Walter Barton scheduled to take place tomorrow. Have you seen or feel any reason to intervene?
I do not. That will move forward as scheduled.
Hi, Governor. So kind of going on the bills with the absentee voting bill and the vote by mail, one, do you expect to sign that bill into law?
Yeah, again, we're going to take a look at all that. I just don't want to commit today until we get all that evaluated by the legal team and the people in the administration, because there's too many things could change why we wouldn't sign something. I know that's going to be one that you're going to be wanting to know, hey, what's going to happen with that bill? And a lot of people out there is going to be wanting to know because of the June election. So we're going to take a look at that. That'll be one of the first ones we look at.
Yeah, I had a follow-up for that. We have some county clerks that are saying that with the deadline, they won't be able to offer that for the June election. What would you tell voters just kind of for that June election that may be concerned?
Yeah, I think we know we're under a timeline here, so we're going to try to take a look at that real quick and make a decision on it early on. Literally, we just have to make a decision on that one pretty quick to even implement it by the election time to do that. So there's several things out there. We'll be dependent on election times or when they're scheduled to go in the elections, whether it's in the primary or the general. So all of those things we'll have to kind of decide in the next few weeks.
I have another question. Sorry, just about the Dr. Williams mentioned the order for testing of the Sentinel testing. What could you kind of explain a little bit more about that, or do you have any idea? Because you mentioned testing is so important.
Yeah, look, we got to do as much tests as we can right now. Frankly, one, because we know more now and we know how to do a lot more testing, such as boxed-in testing that we talk a lot about, nursing homes, St. Louis region example, which still having troubles up there. We got to be able to figure out how we do a better job up there, and we are doing a better job. But we need to be able to really start evaluating people out there on the Sentinel testing, where you just go out there and evaluate people from across the state that want to be tested, that want to do that. And really, there's a short-term advantage to that and then a long-term, because we know flu season is going to be starting up here in September, October. Now, that sounds a long time away from what we've been going through, but the reality of it is it's 3 or 4 months away, and we got to be prepared for that and to see where we're going. So as much information we can have between now and then, I think one's going to help the people of the state to be able to understand more and more about COVID-19, and again, to know the difference between flu and the coronavirus. And so all the testing we can do, and we can identify the people that's had it, will help us, and it'll help everybody down the road, especially with school starting and everything. So, there's kind of two parts to that testing, but the testing is just valuable. We just got to do a better job of that, and we're going to do that, because, I think it's very important for the people of the state.
Hi, I just want to circle back to something you brought up last week about domestic violence being up. I know there wasn't a lot of statistics last week. Do you have any new information about that this week?
Yeah, well, I think that's something we're watching on the domestic violence. The longer the stay went on in different areas of the state, things like that increased. The mental health issues increased somewhat, suicides. All of those things started increasing a little bit. And you can understand domestic violence. The child abuse, went way down. Well, that's a concern to all of us. What happened there? I want to say I'm optimistic to say, well, I hope it's just down that much. But the realistic side of me thinks, hey, there's a reason for that, and we need to make sure to protect people. So I think those are all concerns that we know are out there. Again, you just can't give all your attention to this virus and forget about all the other things it's creating. When you look at all the other things, whether it be the economy, whether it be the healthcare system, all of those things we're going to have to deal with.
Are you moving any additional resources into investigating any of this at all?
Well, right now we depend on the information where it comes in. For whatever region of the state, we're probably reaching out to those law enforcement issues up there, different people like that, the mayors that we have discussions with weekly. We try to find out, hey, what is spiking that? And I think right now we're all trying to figure that out. I mean, we kind of assume because everybody's been at home, maybe that's. Look, we're going to be extremely aggressive on testing in the state of Missouri.